My name is Shanaza Chagzad. I'm an FNP. I work as a hospitalist in primary care medicine and addiction medicine. It was something that I just fell into. I studied biochemistry initially in college, and then after that I took a very long route into medicine. But long story short, initially I wanted to go to a pharmacy school, but that didn't pan out. Dropped out of school after grad school, during grad school. And then I decided to do a bridge program where I ended up getting a master's in nursing and another bachelor's, and then I did that for a couple of years, and then I went to family medicine and went to school for that. And prior to that I worked in intensive care unit. And my love affair with medicine or intensive care unit was when my dad was ill when I was younger, in undergrad school. I was in UC Irvine at the time. My dad became ill and he was in an intensive care unit for close to 6 months, I want to say. So I remember how intense it was to care for my dad with all the lines, all the IVs, all the drips. And I thought that was kind of a very difficult job to do. And subsequently, when I ended up finishing school, I ended up doing that job. I wanted to kind of do it for myself and can see. And then doing it for a few years, I was like, well, this is kind of something I like. And then eventually went to family medicine, primary care, in a different role as a provider, as an FNP. It gives you more autonomy. Essentially, you're practicing on your own, and you don't have any supervision or anything like that because you get to be licensed to do that. How, in terms of medicine or healthcare, I would say most of my older siblings, my two elder siblings, were in healthcare, and my other brother also was in healthcare. He was in as a technician in MRI radiology, so it's kind of like a step, it was already established field for my elder siblings, and I thought they were pretty successful in their lives, so perhaps I should follow their footsteps. And also it's been a proven stable type of career where you can achieve professional growth, but also stability in terms of job stability, financial stability, and also providing to society at large, providing a service that is so needed and rewarding at the same time. Well, undergrad was challenging because I had just immigrated a few years prior to that. So when I went to college, learning English was still a process that I had to go through. I came in the early 90s, mid 90s. So I was a sophomore when we moved to the United States. So I went to high school for 3 years, and then I subsequently went to college. And so college was a relatively complicated and difficult process for me. But nevertheless, I was able to get into a good university. I went to UC Irvine, a local university here in the city of Irvine. And then ended up going to grad school after that. It was tough, I'm not gonna lie, but it was also fun. I didn't know what I didn't know, but at the same time, it motivated me to do better and exceed expectations. Biology. Well, I double majored biology and poli-sci, and I also took several classes in comparative religion and philosophy. That was more for self-growth and self-fulfillment, not necessarily a career choice. Knowing sometimes that you may not be able to help your patient get better or achieve a form of health that is conducive to a healthier life. So primary care medicine is a little bit rewarding in that sense, because you know that you can help them, you can catch disease in its prevention process and kind of follow up with the patient, whether it's diabetes, hypertension, or predispositions to cardiac diseases or heart disease or things like that. However, addiction medicine is a little bit tougher. Sometimes we get patients that are far gone into their addiction, and it's really hard to get off of it. We try to achieve that, but sometimes it's not achievable. And when you hear a young patient of yours OD'd or died from their affliction, it's breaking. But again, I feel like if I can just save 1 out of 100, then that gives me some sort of satisfaction, because I know that I'm doing something that can alleviate some pain and suffering in someone's life. And it is a problem that is an epidemic in this country, in the United States. We lose a lot of our youth and young people and the general population to drug addiction and drug affliction. So, knowing the facts, I'm glad to be in the field where I can actually make a difference in getting them off of their drugs, if possible, and also achieving their primary care needs. It stands for a family nurse practitioner.
Okay.
It is a nurse that goes to additional schooling to be licensed to practice medicine. So you're, hence the initials or acronym, family nurse practitioner. As a day-to-day job, same thing as if you were to go see your doctor in a regular setting or primary care. If you come to see me for your regular checkup, your regular physical, anything that is encompassed in primary care or family medicine. If it is beyond the scope of my practice, then I would refer them. If it's a cardiology or neurology or anything that I don't have the expertise, then they would be referred out. The biggest challenge would be, there's many challenges. I would say financial challenges were very difficult to overcome, because not having the finances to go to school but yet being in school. So to take that step, and whether it's student loans or whatever, to decide that you're going to do that, it's kind of challenging, because I came from a family that didn't have much background, nor did they have any information about it. So I didn't have that support. Not that they weren't supportive, they just didn't have the means. Of course, language always was a barrier, but I overcame it. I would say, other than that, it would be, are you in the right field? Is this something that my passion, and whether I would love this 10 years from the day I start, or 20 years going forward, because I don't want it to become monotonous, that it simply becomes a job rather than a calling or a profession. The advice I've received, working through your dream, achieving whatever you set yourself for. I think anyone is able and capable of achieving their dreams, so long as they're willing to put in the work for it. And a lot of hard work and dedication. Intelligence is important, but dedication is what gets you in life. And if you don't dedicate and you're not disciplined, you will not succeed. I think my family was my biggest motivation, but also my biggest support, and also my biggest critics. So they encompassed all of those things for me. My mom and dad, my sister, my brothers, even the little munchkins, my nieces and nephews. They make me want to be a better person, so that I can be a better role model for them, so that they can follow in the positive footsteps of those in the family that have a positive outlook on life, professionally, and educationally and financially. First of all, you have to have passion for something you want to do, because if you don't have passion, then it becomes more of a chore. Secondly, you kind of have to know what you want to do early on, so you're not wasting time. College is a very expensive and a lengthy endeavor, and if you're willing to put 4 or 5 years into it, plus another 4 or 5, depending on what career path you choose, it's a long time and it's expensive. So you should know early on that you want to do, so that when you are in college, you're not wasting time. I know college is also a time where people discover what they like and dislike, and that should be your first and second year. But you should also have some sort of a direction already ahead of in mind, so that your career choices and the classes you take reflect that rather than taking classes vicariously, not knowing what you're doing. Because again, you're wasting your time and resources and time. Time is the most valuable thing anyone can have. Once you lose it, you don't gain it. You don't get it back.